Yeah, I just want to say that the progress that has been made in the treatment and outcomes of childhood arthritis in the last, 10, 15 years has been tremendous. Really has changed the outlook for any child diagnosed currently with arthritis. Because, maybe even 15, 20 years ago, we would see children who were diagnosed with arthritis who were disabled, even crippled, had terrible deformities that were basically lifelong. And we hardly ever see that anymore. We have actually, I have a favorite slide of mine that shows a picture of kids at a juvenile arthritis conference, around the year 2000 or so, and some are in wheelchairs. Some are using assistive devices, and you can clearly see that there's something wrong with these kids physically. And then, I next to it is a picture of kids at a arthritis camp, the last 5 years, and you can hardly tell. You cannot tell actually that there's anything wrong with them because of the progress that we've made. And really, the progress has really been largely due to medications that have, really changed the landscape of the treatment of inflammatory arthritis in general, and now are being used in children who have arthritis, such as biologic medications, which started initially with TNF inhibitors, but now have really multiplied to medications with many different mechanisms of action, as well as other types of medications such as JAK inhibitors that are all incredibly effective. And so, the kids that get diagnosed can really benefit from knowledge of specialists in this area who know how to use these medications and can treat them the way that they should be. Aside from developments in terms of new medications that are on the horizon, and new treatments, I think a very important, actually, a study is about to launch, which is actually one of the first global investigator-initiated studies. And this is a collaboration between an organization called CARA, which is the Childhood Arthritis and Rheumatology Research Alliance, which is the North American Pediatric Rheumatology Research Network that I'm a part of, and PRESS, which is the Pediatric Rheumatology European Society. And we are working together to answer the question about, we have great medications and many patients respond to, such as we talked about the biologics and TNF inhibitors. But some patients don't respond, so, what is the best approach for those patients? So, do we start different, because there are different types of TNF inhibitors. Many rheumatologists will switch to a different TNF inhibitor. But there are also IL-6 inhibitors. There's also, T-cell co-stimulation blockers. There's also JAK inhibitors now that are available. So, and we don't know now which ones we should go to first. Is one work better than the other? So there's actually a study to try to address this question that we're going to be starting called SMART JIA. So we're very excited to start and to know the results of this. Another, important question is, is it safe to take medicines away? These medications work really well. But, what happens, after, how long do you have to wait, for example, to, withdraw a medication? That's always something that that parents ask and that we want to know is it safe? Because sometimes when we stop the medication or we reduce the dose, then the patient flares up. But we don't want to keep treating a patient for years and years, if the patient doesn't need it. But we don't have good markers that will help us understand which path to take, and whether it's safe to withdraw medication. So that's another really important question that really need to answer.